So what are the effects of cryotherapy? So that we know there are several effects. One is we know that the cryotherapy on the right produces pain relief, because what it does is it reduces inflammation. And Dr. Boswell talked about that a little bit more. We also know that because of the cold temperatures, that you get a hypometabolic state where actually the needs of the foot for glucose, for oxygen, are actually decreased. Again, I think about the bear that hibernates up north, and they do that and they're able to survive for months without eating because their metabolic needs are actually so small. And we also know that it causes vasoconstriction. And if you think about the video I just showed you, you saw that these laminized trigger factors actually are circulating and actually target the foot. And if you can restrict that vessels by using cryotherapy, what you do is the foot is actually exposed to fewer of these trigger factors that ultimately result in laminitis. So that's the theory behind it. And this happens in any sporting individual, whether it's a two-legged or four-legged athlete, is that we know that cold therapy provides pain relief. It actually reduces the metabolic demands of that muscle or that foot or the lamellar tissue, and actually causes some vasoconstriction, which actually provides some pain relief. So the types of cryotherapy, you could walk around here, I'm sure, and you'll see multiple different means and types of cryotherapy. And so if you look at here are just some examples, and my colleague Andrew Van Epps and I actually did an experiment. We compared all the different types of cryotherapy to see which ones actually reached our target temperature, and that being a temperature somewhere in that 5 to 10 degrees centigrade, so somewhere in that 35 to 40 degrees Fahrenheit. You can see that there are all types out there, and the ones that actually were the most effective, I'll show you in a moment on a graph, but this ice horse boot and system is actually these ice crystals, and on your table, each one of you had a bag of that, and that's actually a new concept scientifically. Instead of, if you were to take a ice pack and you were to put it in your refrigerator, it would come out as what? One big ice cube, right? The beauty of this is actually small crystals. So what it does is it actually allows you to mold that pack around the horse's leg, so it actually has an intimate contact. And that's number one. That's one of the most important things that you need in order to effectively cool the horse's leg or the horse's foot, is that ice has to be in contact intimately with the tissue that it's cooling. Because what you're doing is you're transferring heat from the foot and then transferring cold from the pack to the foot. All right, so there is this system that goes back and forth. So it's a very unique system that is being used on the human side, and Julie has actually introduced this in the equine world. So it's really a new concept, and they actually designed a boot so that the horse's foot fits in here, these ice packs fit around there, and then they just come up and Velcro together, so you can actually get that intimate contact that you want, and it actually fits behind the pastern, comes up around the fetlock. And we know that in order to effectively cool the horse's foot, that you need to pre-cool the blood coming in. So it needs to include both the fetlock, the pastern, and the foot. If you just cool the foot or the coronary band, it doesn't work.